Do you frequently feel like your heart is pounding out of your chest after a car accident, even if you're safe now? Or maybe you feel like the world isn't real, like you're in a dream. These might not just be normal reactions, they could be signs of acute stress disorder, ASD. ASD is a mental health problem that can happen to anyone after going through something very scary or shocking, like a serious accident, attack, or natural disaster. It usually starts within minutes, hours, or days after the trauma. Think of it like your brain's alarm system going off, even when the danger is over. For example, imagine you witnessed a robbery. A week later, you can't sleep, keep reliving the scene, and feel numb all the time. That's not weakness. It might be your mind struggling to recover. The good news, it can be treated, especially if you notice it early. So what causes acute stress disorder? It's not just about what happened, it's how your brain reacts to extreme stress. ASD usually happens after an event where you felt your life was in danger or saw someone else get badly hurt. Examples include surviving a fire, being in a violent assault, or seeing a terrible accident. But not everyone who goes through trauma gets ASD. Why? Some risk factors make it more likely, like if you've had trauma before, if you're going through a lot of stress in life, or if you don't have people to support you. Let's say your friend went through a bad earthquake. They weren't injured, but they keep having nightmares and avoid going outside. That's ASD in action. The brain is trying to protect you by staying on high alert, but it's stuck in overdrive. How do you know if someone or you might have ASD? Look for these signs in the first month after trauma. First, repeated, unwanted memories of the event, like sudden flashbacks while doing homework or driving. Second, avoiding anything that reminds you of it. Maybe you refuse to ride in cars after a crash. Third, feeling on edge, constantly jumpy, irritable, or unable to sleep. Fourth, negative emotions, feeling empty, guilty, or like nothing matters. Fifth, feeling detached from reality, like walking through a movie. For example, a student who saw a school fight might skip classes, avoidance, burst into tears for no reason, emotional changes, and say, "It feels like I'm not really here," dissociation. If these last 3 days to a month, it could be ASD. There's no blood test for ASD. Doctors diagnose it by talking to you. A mental health expert will ask about what you've been through and how you've felt in the past days. To be diagnosed with ASD, you usually need to have at least 9 out of 14 symptoms from specific groups: intrusion, negative mood, dissociation, avoidance, and arousal. For treatment, the best option is therapy, especially a type called CBT, cognitive behavioral therapy. It helps you face scary memories in a safe way and change negative thoughts. For instance, a firefighter with ASD might work with a therapist to slowly process the memory of a child they couldn't save, not by forgetting, but by learning to live with it without panic. In some cases, doctors might suggest short-term medicines for sleep or anxiety, but therapy is the main key. Early help can also prevent PTSD, a longer-lasting problem. You can't stop a disaster, but you can build emotional strength before or right after. Support right after trauma is powerful. Talking to a friend, counselor, or family member can calm your brain's alarm. Imagine a soldier returning from a dangerous mission. If they can talk about it with a support group the same week, they're less likely to develop ASD. Other ways include learning stress management, like deep breathing or mindfulness, staying connected with people, and avoiding isolating yourself. Even writing in a journal for 10 minutes a day after a tough event can help process emotions. Prevention isn't about being tough. It's about giving your mind the care it needs after trauma. Science is learning more about how the brain handles trauma. Recent studies show that early therapy within days of trauma can reduce ASD and prevent PTSD. For example, one 2023 study found that a 3-session CBT program given to accident victims in the ER lowered ASD rates by half. Also, researchers are testing apps that guide people through calming exercises right after trauma, like an emotional first aid kit on your phone. Another advance, some doctors are studying how hormones like cortisol affect trauma memory, possibly leading to medicines that protect the brain right after a scary event. While these are still developing, they show hope. We're not just treating pain, but preventing it before it grows.